Good evening, wherever you are. This is Benji Cross from ConferenceHype. Our segment will focus on targeting ADAR1-mediated RNA editing inhibits hepatic stellate cell activation and liver fibrosis by enhancing HSC intrinsic innate immunity. From the 2026 August 6 edition of Gut. Background: chronic HBV infection remains a major global health burden, with current antiviral therapies effectively suppressing viral replication but rarely achieving functional cure. Methods: adaptive immunity is central to viral clearance but is profoundly impaired during chronic infection. Results: inducing and enhancing adaptive immunity through therapeutic vaccines, immune checkpoint inhibitors, or T-cell-based therapies represents a promising approach for HBV cure strategies. Discussion: in this review, we summarize current knowledge of the correlates of viral clearance and persistence, discuss key unresolved questions, and outline future research directions needed to advance immune-based HBV cure strategies. From the 2026 August 6 edition of Gut. Background: chronic visceral pain in IBS with diarrhea is a profound therapeutic challenge. Methods: combined functional MRI with visceral sensitivity assessments was used to pinpoint hyperactive brain regions of patients with IBSD results. Clinical observations identified hyperexcitability of the medial prefrontal cortex as strongly correlated with visceral pain in patients with IBSD. Discussion: hyperexcitability of the MPFC drives chronic visceral pain in patients with IBSD, and LFR-TMS provides analgesia by suppressing this hyperactivity, offering a novel mechanism-based neuromodulation strategy for IBSD treatment. From the 2026 August 11 edition of Gut. Background: interleukin-10 is an essential regulator of intestinal immune homeostasis. Methods: we conducted a cross-sectional multicenter study across pediatric IBD cohorts from 4 countries. Results: anti-IL-10 positivity was identified in 26-10-45 pediatric patients with IBD, Crohn's disease N equals 6, UCN equals 19, IBD unclassified N equals 1. IBD diagnosis age of 13 plus or minus 3 years. Discussion: anti-IL-10 autoantibodies are present in a subgroup of pediatric patients with IBD and are associated with difficult-to-treat disease. From the 2026 August 6 edition of Gut. Background: primary sclerosing cholangitis-associated UC carries excess colorectal neoplasia despite often mild-appearing endoscopy, implicating persistent microscopic inflammation and microbiota bile acid dysfunction. Methods: surveillance colonoscopies from PSCUC and UC only were compared for segmental endoscopic histological activity and dysplasia. Results: PSCUC showed greater inflammatory activity and a right-shifted dysplasia burden versus UC only. Discussion: PSCUC neoplasia associates with transmissible microbiota-dependent inflammation and secondary BA deficiency. From the 2026 August 6 edition of Gut. Background: introduction. Colonic diverticulosis is the most common structural abnormality of the colon in developed countries, with an increasing global prevalence. Methods: this international consensus, developed by 32 experts from 14 countries through a structured Delphi process based on the PICO framework and grade methodology, provides evidence-based recommendations across 5 domains: epidemiology and pathogenesis, clinical features, diagnosis, medical therapy, and surgical management. Results: key statements define diverticulosis as the presence of diverticula without symptoms and diverticular disease as diverticula associated with symptoms or complications. Discussion: These consensus statements aim to standardize and optimize the diagnosis, management, and prevention of diverticular disease across diverse healthcare systems, while highlighting research priorities such as microbiome characterization, genetic risk profiling, and long-term outcomes of selective antimicrobial and surgical strategies. From the 2026 August 6 edition of Gut. Background: the optimal surgical strategy for adenocarcinoma of esophagogastric junction remains debated, particularly regarding lymphadenectomy extent, gastrectomy type, and surgical approach, with real-world prospective evidence being scarce. Methods: the Chinese League of Adenocarcinoma of Esophagogastric Junction Registry, initiated in 2022 across 44 high-volume Chinese centers, prospectively enrolled AEG patients. Results: most tumors were Seward type 2 or 3. Discussion: the CLAEG study shows that abdominal lymphadenectomy should be prioritized in AEG, with neoadjuvant therapy, total gastrectomy, and laparoscopy associated with favorable short-term outcomes. From the 2026 August 6 edition of Gut. Background: Kupffer cells and monocyte-derived macrophages are difficult to study in human primary biliary cholangitis, even though they reflect a dynamic hepatic immune population. Methods: phenotypic analysis of hepatic macrophages in patients with PBC and DNTG, F-beta rare mice model was performed by single-cell RNA sequencing, flow cytometry, and immunohistochemistry. Results: Kupffer cells from patients with PBC and DNTG, F-beta rare mice upregulate genes associated with inflammatory responses and exhibit increased autophagy. Discussion: macrophage autophagy promotes autoimmune cholangitis and strongly supports this pathway as a potential therapeutic target. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 August 6 edition of Gut. Background: metabolic dysfunction-associated steatotic liver disease-related hepatocellular carcinoma is an emerging malignancy with limited therapeutic options. Methods: we performed expression profiling in human MASLD-HCC samples. Results: CD133 plus CSCs were significantly enriched in human MASLD-HCC tumors and positively correlated with established markers of malignancy. Discussion: this study established CD133 plus CSCs as critical mediators through the CD133MYH9/beta-catenin axis in MASLD-HCC. From the 2026 August 6 edition of Gut. Background: pancreatic ductal adenocarcinoma is characterized by a dismal prognosis and insensitivity to immune checkpoint blockers. However, the underlying mechanism remains elusive. Methods: multiomics analysis and clinical cohort studies identified protein disulfide isomerase family, a member 6, as a regulator of the immune microenvironment. Results: multiomics screening identified PDIA6 as a biomarker of CD8 plus T-cell paucity and poor prognosis in patients with PDAC. Discussion: PDIA6, driven by KRASG12D, alleviates ICD and promotes immune evasion, functioning as a predictive biomarker to screen ICB-sensitive patients and a therapeutic target to improve ICB efficacy in PDAC with KRAS mutations. From the 2026 August 6 edition of Gut. Background: metabolic dysfunction-associated steatohepatitis-related hepatocellular carcinoma has been reported to be less responsive to immune checkpoint inhibitors, which may be associated with metabolic reprogramming of tumor cells and abnormal tumor microenvironment. Methods: hepatocyte-specific phosphatase and tensin homolog and PCK1 biallelic knockout mice were established to induce MASH HCC. Results: PCK1 is downregulated in tumor tissues compared with adjacent non-cancerous tissues from patients with MASH HCC. Discussion: this study reveals the pivotal role of the hepatic cell intrinsic enzyme PCK1 in mediating CD8 plus T cell dysfunction via 12-HETP38 signaling in MASH HCC. From the 2026 August 6 edition of Gut. Background: RNA 5-methylcytosine has emerged as a critical epigenetic regulator in cancer biology, yet its role in the tumor immune microenvironment remains incompletely understood. Methods: the clinical significance of NSUN6 was assessed in human PDAC cohorts. Results: NSUN6 deficiency significantly enhanced macrophage accumulation and polarization toward immunosuppressive phenotypes, thereby impairing CD8 plus T cell-mediated antitumor immunity in PDAC. Discussion: NSUN6 deficiency drives immune suppression through the M5C-KDM5A-CCL2 axis in PDAC. That's it for now for ConferenceHype's coverage of the August 2026 issue of Gut. If anything was missed, tell us which article deserves follow-up. Tag us on X. Add your perspective in the comments. Share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.